Good morning. Welcome to City Talk, a weekly program and podcast produced by the City of Waco and presented by this station as a public service to educate and inform you about the operations and work of the City of Waco. During the next half hour, hope to bring you some interesting conversation with our city staff, whose goal is making Enviable a safe and a healthy place to live and work. I'm Larry Holsey, Director of Municipal Information for the City. I'll be your host for this program. Today, I'd like to welcome Vadeha Shaw, who is the senior epidemiologist. I can get this right, I know it is, with the Waco-McLean County Public Health District, along with Stephanie Alvey, who is the preparedness coordinator. And we're going to be talking about something that's in the news a whole lot. We're going to be talking about the coronavirus. We're going to answer a lot of questions maybe that people may or may not have had. We're also going to bring you up to date on the latest flu information, because that's one of the things the health district also tracks locally. That's through the years you all do, and hopefully we're on the downswing of some of that. But we can. So here we're recording this program now, actually on February the 13th, a Thursday, prior to its air date on Sunday. And I say that only because anything that you hear on this program right now, this is a continually kind of a very fluid situation. I mean, so what we talk about today, things may change just a little bit or whatever. And don't say, well, today what I heard on Sunday, I heard this is on Thursday as it is. But hey, you are the epidemiologist. First of all, explain what an epidemiologist does for the health district and that type of thing, and then I'm going to let you ladies just take it and kind of go from there. Tell us what an epidemiologist does and then the role that you play in providing information.
Sure. In 2 words, epidemiology would be disease surveillance. Okay. So we survey infectious diseases and non-communicable diseases. So anybody who's tested positive for, we have a list of about 90 conditions that we track, infectious conditions. Mm-hmm. Any McLennan County resident who's tested positive for any of those conditions, we get a report and we will further investigate, figuring out how they may have got it and making sure that it does not spread to the rest of the community. Okay. And then on the non-communicable side, we work with other departments in our organization on building coalitions and education programs to reduce the disease burden in the county. That could be diabetes, that could be cardiovascular diseases, healthy eating, active living. We work on that end.
Yeah, you're talking to somebody that has a problem with eating right here, so we can talk about that later on. But, well, that's part of the mission and goal. Mm-hmm. And Stephanie, you might be better, not better, but also add to that what the goal of the health district is, because I know Kelly Crane and I, we've talked a lot of times on that. But the health district does so many different things. In addition to what you just said, there's things that you all continually monitoring in the background, what's going on in the health and vitality of the community and how we can be more healthy. Talk a little bit about that.
Right, yeah. So VEDI, through the epidemiology program, they do surveillance on diseases, but we also have other control measures and things that we work on a day-to-day basis, like immunizations to make sure that people are getting immunized so we don't see those types of diseases popping back up in the community. We have our environmental health programs that inspect restaurants and make sure the food and everything is safe to eat so we don't have any of those kinds of, foodborne illness related outbreaks. We have access to vital records so we can track that, data to see what the incident, what the causes of death and things like that are in the community. We have that within the health district. So there's a variety of different programs and initiatives that we undertake.
And I know you get involved with a lot of different things, and the flu is one of them. We'll talk about that a little bit later. Well, let's delve right into the main topic we're talking about, the coronavirus. First of all, what is the coronavirus? Maybe how did it get its name? And we know it comes from China, so to speak. But talk a little bit more about what is the virus we're talking about here. And it is a virus compared to any other type of disease or whatever. And it's somewhat like the flu, maybe. I'm telling you what not to say. I want you to tell us what it is. What is the coronavirus? And maybe parallel it to the flu, because that seems to be our worst exposure that we keep looking at.
Yes, so coronavirus it's a large group of viruses. And these may cause illnesses in animals and humans. Mm-hmm. There are some coronaviruses that are commonly circulating, like common cold is caused by a coronavirus. What we are concerned about right now is the 2019 novel coronavirus, or it's got an official name now that's called COVID-19. That is a new strain of the coronavirus which has not been identified before this, and it has been first time identified in Wuhan, China.
Okay. And so there's where the heart of that specific part of China
Yes.
that we've really probably never heard of very much, but they have millions of people living there, and they're doing what I would consider, I'm certainly not a medical specialist, but it seems like they're doing an amazing job of trying to control and isolate and quarantine, any of those words you want to say, of keeping it in their area compared to spreading it to the rest of their country, for that matter. And I know we've heard about cruise ships and things like that and whatever. It comes from China, that particular location. Bring us up to date as of this recording time. Where is it now? Is it still there? And is it being spread primarily by people who have been to that part of China? Is that still pretty identified? So they've not picked up any other locations that it's a hot spot as it may be, or something like that?
So yes, it did originate from Wuhan, China. Initially, early on, when people got sick, they had exposure to a live seafood market that was in Wuhan, China. So it was considered to be an animal-to-person exposure. And then after that, we saw a lot of cases in people who had not visited the market. So that proved that it is causing human-to-human transmission. Right now, there have been thousands of cases around the world, but still the epicenter of the outbreak remains Wuhan, China. And everybody may have heard in the news there are several measures that all countries around the world are taking. Citizens coming back from China from Hubei province, China, have to be mandatory quarantined for 14 days. And that's in most all countries around the world. So we are trying to limit the outbreak as much as we can.
And when you say what limit, you're quarantining, which means
Yes.
we're not allowed to be like right now. You and we're all sitting in the room probably 3 feet apart, and that would be acceptable for a situation because it is an airborne disease. Is that correct?
Yes, it is spread by respiratory droplets. That is just how your flu is spread. When somebody sneezes or coughs and you come in contact with those respiratory secretions, you can get the virus.
I'm not asking for an opinion necessarily, a medical opinion, but I see a lot of people wearing the masks. There's been some reports the fact that doesn't really seem to help that much, or maybe it protects the individual from spreading it, but not so much the whatever. What is your evaluation of the information you've received about that?
I'm so glad you asked that. Right now in the United States, that is not something that is recommended. Masks are recommended for individuals who are sick so that they don't spread it to anybody else around them, and for healthcare personnel who come in contact with people who are sick. It is not for the general public.
Okay, so you should not be thinking, first of all, in Texas and especially in Waco area, the chances are, I'm not going to throw out a number, but it's very, 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 very
Yes.
small. You'd have to be close to somebody who has been exposed in there. The wearing of a mask is not going to prevent you from getting it. It's more so the mask is preventing giving it to somebody else.
That's right.
Okay.
Yes.
Well, I've seen that and I've heard that, and I thought, okay. And we always hear reports of different types of things. Well, that's true, that's false, that's true, whatever. Who is it and what is it? So anyway, that kind of thing. I guess the biggest thing that always people get concerned about in disease situations like this, and I maybe want you to name some other things that we've kind of gone through, and the health history has helped walk us through other types of viruses and exposures that we've had in the past. But, one of the things that we constantly just look at is the fact that, there's something out there all the time that we're going to get if we don't watch it. But, it's just there's something out there. But the virus that we're talking about here is new and unique.
That's right. And I think that's what the concern is, because there are a lot of unknowns that it has been a panic. Otherwise, when we think about prevention, the way you can prevent this virus is literally the same steps that you take to prevent flu. Get your flu shot. Don't come in contact with people who are sick. Wash your hands 20 seconds using soap and water. If you don't have soap and water, use an alcohol-based sanitizer. You cover your cough when you sneeze or cough, and then dispose of the tissue in a lined trash can. These are things that we have been trying to promote since years.
Yeah.
So yes, if you follow these precautions, and especially with the United States not having, especially Texas not having any confirmed cases of coronavirus, the threat to the general public is very, very, very low.
Yeah. And it's more of a worry. You see the news and you start thinking, oh my goodness, I'm going to die, or what, I'm going to get it, and that kind of thing. And I don't know what the statistics are, but even those who have been exposed to it, and I'm using those examples on the cruise ships, for example, where they're quarantined and they're whatever else. Some of them have the high fever, which I think is one of the symptoms, just like flu. Or the symptoms are pretty parallel to the flu, correct?
Pretty much, yes. It's fever, shortness of breath, and cough are the common symptoms that we've we've seen so far.
So you could have the flu, but you could also think, okay, now I've got the coronavirus, and so that's that panic because again the media has kind of shown everybody what is happening, and we all tend to get that scare factor. In fact, I'm going to be that one new case in the United States and in Texas, and then I'm going to get it because that person didn't tell me they've been over in China or whatever else. And that's the thing. You all in the health district probably have the most important role is making sure people do not panic. Stephanie, as far as being a preparedness, you're in emergency management type situations a lot of the times, kind of making sure that doesn't get out of control.
Right, yeah, that's a big part of the public health response is educating the community and making sure that they all know what their risk is and what steps they can take to stay informed and protect themselves and their families. And so, the public health response to any type of disease is always going to be, it's going to have a big component of public education and communication. Well,
and I'm a firm believer, and I don't know if this is clinically been proven or not, but I think if you have a positive attitude and think and protect yourself, just as you've indicated, there's a lot of things we can do besides panicking and thinking negative about things and worrying about it. And sometimes you can worry yourself into feeling sick somehow or another, and you may not certainly get the coronavirus, but those types of things. So your healthy attitude can certainly make a big difference.
Yeah, promoting vigilance and ensuring that people stay informed, and that's as important as any other type of response that we have.
If you've just joined us, we're visiting with Vadeha Shaw, who is a senior epidemiologist for the Waco-McLennan County Public Health District, and Stephanie Alvey, who is a preparedness coordinator with the same health district. And we're talking about right now the coronavirus and finding out a little bit more about it than maybe what you'd like to think, and especially localizing it and saying that really, thankfully, in the Waco and Texas area for that matter, we don't have to worry about it. We don't have to be concerned. Be vigilant, like you say, and if nothing else, do the same treatments and things that you would do to avoid the flu. Now, you mentioned earlier about getting the flu shot. Is there any proof or anything that the flu vaccine would help either minimize or have anything to do with this, since it is still a virus that's entering into your system?
No.
Okay.
There are two different types of viruses.
Yeah.
There is no vaccine for the COVID-19, but yes, no, to answer your question.
I didn't think so, but you mentioned that a while ago, kind of in the context that we were talking about. But I think just being the vigilance and doing the things for the flu is the same thing. Which brings me to the question now, so here we talk about the virus. What is there any treatment? Is there anything that can be done if someone were to get it? And I'm again going to reiterate the fact that we're not thinking it's going to be anywhere. We're talking to but people sometimes ask the question, like I did, exactly, okay, if these people who do have it, what are they taking? What are they doing? They're controlling their fever maybe, or what else? Is there anything?
That is what it is. We don't have any specific antiviral medications for this COVID-2019, but it is providing supportive care. If somebody has fever, you give antipyretics. If there is cough, then you're giving anti-cough medications. It is all supportive care right now.
Yeah.
And those people who have been diagnosed with the coronavirus in the U.S. have all been isolated in medical facilities.
And I think that's a great thing about some of the communication. I don't mean to, earlier it sounded like I was maybe not saying positive things about the communication by the media or things like that, but I think that's a good thing because now we are maybe alarming some people, but mostly informing people about what's going on in the world. And then we can very quickly, and thanks to the cooperation by all the health agencies across the world, they're doing their own thing to take and protect, quarantine, and so these virus spreads that we have. Now, what other thing, I kind of put you on notice a little earlier, what other sicknesses, viruses, or things that you've maybe remembered that we've had that were similar to this, that has struck the nation or that have been a threat to the health and well-being of our community that, that maybe we've gone through and we've totally forgotten about by now?
Well, I think the big one is probably Ebola. I don't know. We certainly haven't forgotten about it, but that was back in 2014, and it had a very similar, it started overseas. Travel history was always a big component of your risk in that disease. More recently, I think we've dealt with Zika, which was also started in South America, had a large outbreak in South America, and so we took a lot of steps and precautions to ensure that it didn't take a foothold here in the U.S.
Now, was that one of the viruses that was spread by mosquitoes?
Yes.
Yes, okay. So we've talked about mosquitoes and the West Nile and all that type of thing. So those are things, again, that you all have helped educate us about on how to minimize your exposure, what to do to treat and prevent mosquitoes who are the carriers. And so, that's the neat thing about you guys at the Health District. You're identifying these things and helping us better understand and know what to do to minimize it. I keep saying minimize the exposure of picking up something that could be dangerous to us.
Yeah, that's our number one goal.
Yeah,
is to make sure that the population stays healthy and safe.
I would like to think that maybe 6 months from now or less, or maybe longer, that all of a sudden what we're talking about here about the coronavirus, it is a afterthought. We've totally forgot about it. It's been necessarily eradicated or certainly minimized, much like polio across the world. I remember when I was growing up, polio vaccines and things were just announced, the Salk vaccine and whatever, and polio struck a lot of people. Well, now I'm a member of the Waco Rotary Club, and one of the big projects that the Rotary International has worked on is eradication of polio. And I think from what now worldwide, there's less than hundreds, there's just several hundred cases. It's very minimal now. And who would have ever thought, and you've not heard the word polio in a long time, but it was a devastating thing back in the 50s and 60s. But hey, you've probably seen as an epidemiologist, things kind of come and go, and if nothing else, in your studies, alerts as it may be that you get from the National Health, the CDC, and some of those other places, these are things that you are now trained to look at and say, okay, what is the exposure on this?
Yes.
Yeah. Now, okay, a medical doctor, for example, locally, have they all been alerted on the process? Talk a little bit about that, about how to identify and then how to react if something were to turn up in our community. How is our medical world out there? And we've got some great doctors, hospitals, and things around, clinics. How are they being educated? And I know that's part of y'all's job, is help educate them on being able to identify, process, and then report that information. Talk about that.
Yeah, so on a day-to-day basis, they report all kinds of diseases, as Betty mentioned, and so we just maintain relationships with them. We push out information on a regular basis. With this disease, some health alert notifications were going out early January, I think, was when the first ones went out, and so they know when they receive that kind of communication from us that it's going to be some information that is going to help them in their practice and help them to understand, what the threat is and how to identify it. So we try to give that kind of guidance as much as we can, maintain open lines of communication. They know how to call us if they have a question. So that's, just on a day-to-day basis we work on that, both in the infectious disease world and in any other public health emergency. We try to maintain those relationships just so we know how to call them and they know how to call us.
Well, I know you all get on conference calls and things like that with the Texas Department of Health Services, I guess. Is that y'all's local, your state agencies that y'all work with?
Yes.
And then you got the CDC or whoever else it is from there. And I know you all have been involved, and that's a lot of the information you all get on the current flu. And I want to kind of shift a little bit to the flu because I want you to kind of bring us up to date because you all provide a very interesting flu graphs that we put on our television station. The first one is the different types of strains that are active and how they're jumping up and down or whatever else. And then you have another one that we put on there is the actual number of cases, how serious it is in the area, how many cases have been reported in our area. And to me, it's very interesting information. And some people said, well, I've gotten the vaccine, but I still got the flu. Okay, and we always know that the flu vaccine is one of those kind of a shot in the ears in a way. You're thinking what virus is, what strain it's going to be, and the vaccine is created around that, anticipating it. Sometimes it doesn't happen that way.
Right.
Tell me, because I'm looking at the chart from time. I don't have it in front of me now, but the chart on the various strains. Boy, there's one or so that's up real high. Is that the one that was not maybe covered by the virus, by the vaccine, or what are you finding about the success of the vaccine this year compared to maybe prior years?
So I know this year we have a lot of flu A cases. So yes, we have a lot of flu A cases around the country. And honestly, I don't have an answer on what the response of the vaccine or the effectiveness of the vaccine is yet. It is too early to say that. We would know exactly the numbers. The CDC would print out a report towards the end of the year as to how effective the vaccine was. But from what I know is, yes, we have a high number of flu A cases. So it may be that part of the vaccine which is not as effective as we would have wanted it to be. But as you mentioned, it's the virus, it's the flu virus that keeps changing and mutating every year. Sometimes we may get it right at 90%, and sometimes we get it at 30%. So we have heard concerns that if I get the flu, why do I get the flu shot? Why should I get the flu shot? It's just about getting as much protection as you can get.
30% is better than 0%.
Right.
30% is better. Is exactly right. Yeah. Well, and one of the things about getting the shot, the vaccine, or whatever you want to call it, is the fact that, am I correct in saying the fact that a lot of times it may not cover you for the strain that's more active at that time, but it tends to minimize the impact and the length.
Yes.
Talk about that.
Absolutely, yes. So if you have the vaccine and you still get the flu, the complications or the severity of the illness is way lower than if you wouldn't have taken the shot. You may not need to be hospitalized, or you may not need to even go to a medical care provider. And that makes a lot of difference. We have a lot of people who don't have health insurance, who cannot miss work because of flu, and then the next thing we promote is don't go out if you're sick.
Yeah.
So
stay home.
Stay home, exactly. Considering all of that, even if you get just 30% protection, I would definitely go for that.
Sure. And I think that the vaccines are very inexpensive. I know, thankfully, a very good blessing for us city employees. We get it for free, paid for by the city, because they value, the city understands the fact that if we're hit by the flu, you're going to be out for a week, and your job is critical to the operation of the city. So what better way to make sure that your job, as it may be, all of us, we avoid being homesick for a whole week, and so that stresses everybody when you have to fill in for the coworker or whatever else. So the cost of the vaccine is so low compared to the awards that you get, the rewards, and the value that because there's no
cost of treatment for sure. It's definitely much lower than the cost of treatment.
Yeah, and you don't have to go through the pain and suffering. I mean, because the people who have had the flu, you're saying, oh my goodness. As they always say, hit by a freight train, that type of stuff. But thankfully, I've never had the flu. I've been around people and friends and family, so that's the different thing. So now, it seems like by the chart, and correct me if I'm wrong, I may be putting out wrong information. This is my evaluation. I'm looking at the chart that shows the week by week progress of the number of cases, not necessarily the strains, and it looks like we're just about to the point where I see a whole lot of that starting to plunge down, showing less number of cases. First of all, we're getting out of the winter. We're getting ready to get into spring, and the weather changes. Are we seeing that same type of trend possibly happening? And I'm not saying this for any reason to say don't get the vaccine, because you can still get it, protect, and do that. But, are we getting out of the woods, so to speak, on this year's flu?
I wouldn't say that.
Okay.
So the charts...
I said it, and so don't believe me, and I don't know. I don't know anything. Listen to the epidemiologist that knows.
Having those charts and having that data is a good thing, but the way we get those flu reports are from different healthcare providers, from schools and clinics and ERs. Now, we try our best to get that accurate information every week, but it is possible that one week we did not get a report from a certain organization, and because of that, the number went down. Now, that does not necessarily mean that the number of people who are falling sick is less. We just don't have that data. So I wouldn't completely base all my decisions on that graph. It gives us a good guideline on what is going on in the community. But yes, I wouldn't say what you're saying.
Okay.
Yeah, people definitely. The flu ruins plenty of spring breaks.
Well, I'll agree with that, because I remember that several years ago. It was the same way. It's like, hey, it's supposed to be, spring, and we're supposed to have less of that, because you can actually get the flu year round.
Yes.
Is that correct?
Yes.
Well,
that's right.
and the last big pandemic that we saw, H1N1, hit more in later part of the year. So.
Yeah. Now, one other quick thing. We have a couple of minutes left, but all right. A lot of people say, "Well, I had the vaccine last year, so I don't, I don't have to have it as much this year." There is probably a tiny carryover, but it's not any different. Again, addressing the different strains potentially too.
Right. So that's what with this year's flu vaccine, you may be immune to a certain strain, but that's not the strain of the flu that is going to be circulating next year. So yes, you're still protected against a strain which may or may not be the main strain of concern next year. And that's why we have this flu vaccine that is every year, go get your flu shot.
Just a wild question from way out there. Do you think from the coronavirus experience that we're all going through now worldwide, that this is something they are going to be working very hard to try to develop some type of a vaccine for?
Yes, they are working.
Okay.
They're trying to work on a
So,
vaccine.
that's the good thing about it. There's a lot of very brilliant people like yourself who are not necessarily involved in that particular part of it, but I'm giving you a lot more credit maybe. But you're our representative, and you do it so well, and I just want to tell you that. We appreciate that because as an epidemiologist, it's critical to have people. Now, is Dr. Werner still the health authority for the health district?
Yes.
How's his role in this particular thing? Just monitoring and making sure that the cases and everything that's going on are all under control, and so it's not any kind of a problem or an epidemic or anything like that, and we'll make sure that that's when he normally gets involved.
Yes,
like
we let Dr. Werner is aware of everything that's going on. If we have a suspect case or if we are monitoring somebody, Dr. Werner is aware of all of that. And then if we have to take certain decisions, God forbid, we may have to close something down, or if it is an issue for the public, Dr. Werner may be more involved. But right now, yes, he's aware of the situation and he knows what's going on.
But the best recommendation in the final moments we have here is no matter whether it's talking about the flu, the coronavirus, or any kind of viral, anything of deal, best thing to do, stay home if you have any fever or any symptoms like that. Certainly go to the doctor and get diagnosed. But mostly cover your cough. Wash your hands thoroughly, and you mentioned 20 seconds because that's a pretty fast one right there. And I'm sad as it is, the water here in the men's restroom at City Hall turns off automatically. You push the button and it shuts off, and it did in 20 seconds. So I have to do it 22 times at least. But wash your hands, cover your cough. And stay away from people who are sick.
Stay away from people if you are sick. Don't go out.
Absolutely.
And get the flu shots.
And get the flu shots. And it's not too late.
Yeah.
Absolutely.
Yes.
Vadeha Shaw, who is the senior epidemiologist for the Waco-McLennan County Public Health District, and Stephanie Alvey, who is preparedness coordinator for the Waco, the same organization, the Health District, a department of the City of Waco, has been our guest. Hopefully we've answered some questions and concerns or interested things that people have been thinking about the coronavirus and the flu. Thank you all for what you do. Thanks for being with us this morning.
Thank you. Thank you.
On a routine basis, the Waco-McLennan County Public Health District inspects numerous food establishments throughout the county to assure they meet health district requirements. Using a demerit system to record problems they discover, food inspectors gave the following food establishment 20 or more demerits between February the 3rd and February the 7th. Golson Country Store at 13,097 Golson Road in Golson, 30 demerits. Now, would like to acknowledge the establishments that received no demerits between February the 3rd and February the 7th. In Belmead, Dollar General Store at 1002 North Loop 340. Subway at 903 North I-35. In Hallsburg Shortstop at 173 Old Hallsburg Road. In Hewitt, Dollar General Store at 505 North Hewitt Drive. Stripe Store at 514 Sun Valley Boulevard. In Mart Middle School at 1400 Kensington Street. Burrito Express at 309 East Texas Avenue. In McGregor, Pizza Town at 510 West McGregor Drive. McGregor Senior Center at 416 West 2nd Street. In Moody, Brookshire Brothers at 1810 Avenue D. Best Donuts and Kolaches at 1710 Avenue D. In Robinson High School Cafeteria at 500 West Lindale Drive, and Robinson Junior High at 410 West Lindale Drive. In Waco, Common Ground Sub at 1311 South 5th Street. Aerodrome Cafe at 7909 Carl May Drive. Cefco at 9417 China Spring Road. La Familia at 1111 LaSalle Avenue. Talkmore Meals, Night Flight Donuts, and Sophie's Fish and Chips Commissary, all at 1500 Columbus Avenue. Baylor's Season 3-1 at 1201 South University Parks Drive. WSGBC Daycare at 2525 East Lakeshore Drive. L&L Daycare at 513 Calumet Avenue. Cesar Chavez Middle School at 700 South 15th Street. Indian Spring Middle School at 500 North University Parks Drive. U-Swirl Frozen Yogurt at 100 North New Road. Mr. Oso at 417 North Lacey Drive. Domino's Pizza at 1428 Wooded Acres Drive. Delaney at Lake Waco at 2121 West Highway 6. Rosita's Taqueria at 301 LaSalle Avenue. Roadrunner Motorcycle Club at 1209 North Loop 340. Magoo's at 4601 Hoddy Drive, Luna Juice Mobile at 1516 Austin Avenue, AMC Theaters Galaxy 16 at 333 South Valley Mills Drive, Luna Juice Bar at 1516 Austin Avenue. In West, Czech American Restaurant at 220 North Main Street, Capone's at 200 North Robinson Street. In Woodway, Dana Food Mart at 7325 Woodway Drive. A list of inspection scores for all Waco-McLennan County food establishments is available on the City of Waco website at waco-texas.com. Just click on Departments and scroll down to Health District. The food score link is to the right, listed first. We hope you'll join us again next week for more information about the City of Waco on City Talk. This program is produced by the Municipal Information Department of the City of Waco and is provided as a public service by this radio station.